Today our technologist is going to demonstrate two specialty views of the wrist. The first being the PA scaphoid, or known as the navicular, with ulnar deviation. Our patient is seated at the end of the table with lead shielding. We have a 10 by 12 lengthwise. We're going to center to the center of the image receptor. We're going to have you have a 10 to 15 degree angle toward the elbow. For lab practice, we will only do 15 degrees. You center on the scaphoid navicular bone. Then we're going to collimate 2.5 inches proximal and distal to the wrist joint and 1 inch on both sides of the scaphoid. We have the correct lead marker. In the light field, we are 40 inches SID with an angle on, centered to the image receptor, and we're ready to take the picture. Next, we will demonstrate the tangential carpal canal. Patient seated at the end of the table. We have a 10 by 12 lengthwise. We are going to use a 25 to 30 degree angle toward the wrist. For lab practice only, we will use 25 degrees. We want to be 1 inch distal to the base of the third metacarpal, centered to the 10 by 12 IR, which is lengthwise. We're going to align the central ray to the third metacarpal, collimate to 1 inch on 3 sides of the shadow of the wrist. The patient has their hand flexed back so that the carpal canal shows, and you will see right at the center of the IR the little arch of the carpal canal. We're going to put a marker in the light field and we're ready to take the picture. I probably shouldn't be saying picture. If your patient is unable to keep their hands flexed, you can use something to help them hold their fingers back.